everybody. It's my pleasure from the PVI platform to share with you some insight from Linc Symposium in June 2023. In fact, I was really impressed by release from Japan, from Dr. Ida and Dr. Soga, and from two studies in particular, from the POPCORN study and the CAPSICUM study. In fact, the POPCORN study is a prospective registry in Japan about drug-eluting balloon, and CAPSICUM study is a prospective registry still in Japan about drug-eluting stent and mostly about Eluvia, polymer drug-eluting stent. So, starting by POPCORN study, we can see here the main baseline characteristic of this study. The mean age of this patient. So in total, you can see here that 2,456 patients has been included in this prospective registry. We can see here that the mean age was 74 years old. The majority of the patients were diabetic patients, and we have 41% of the patients with a renal failure on dialysis. So pretty high rate of dialysis and so severe patient. The CLTI rate was 32%, and the mean lesion length was 13 centimeters. So here is a real life registry. You can see that the lesions are pretty long. Regarding the DCB use, mainly high dose DCB such as Impact were used in this study, but also some low dose DCB such as Lutonix in 25% of the cases. Now, if you focus on the 2 years result of POPCORN, you can see here that the 2 years primary patency was 70%, and the 2 years freedom from TR was 80%. So, which is pretty impressive in this so severe patient. Remember that it's close to 50% of diabetic and renal insufficiency patients. What is also interesting in this prospective registry about DCB, they make some subgroup analysis regarding the crossing and regarding the type of DCB. And so regarding the crossing, according to this study, it seems to have a significant advantage about intraluminal crossing in the use of DCB. Now, regarding the dose of DCB, it seems also to have an advantage here for high dose. So here, Impact versus Lutonix, high dose DCB versus low dose DCB. Now we shift for the CAPSICUM study. It's a large registry, prospective registry in Japan with more than 1,000 patients about polymer drug-eluting stents, so Eluvia in this case. This result has been released by Dr. Ida, and also we have a real-world population and real-world registry. The mean age of the population was 75, with also high rate of diabetic, 60%, and of chronic kidney disease, 66%. The CLTI rate in this study was a little bit higher than in the previous study, with 34% of CLTI patients. And also here we can see that we have longer lesion, 18 centimeters. So it seems to have a correlation between the baseline characteristics, or more severe patient, but also with a longer lesion in this study. The popliteal involvement was about 23%. And also we can see here that the IVUS was used in 76% of the cases, which is similar to the previous study. Why? Because in fact, in Japan, the IVUS use is reimbursed. So we can use, in this case, mainly IVUS to assess the result of the DCB and stenting. What are the main information of the CAPSICUM study? In fact, we can see here that the cumulative rate of restenosis after 2 years is 21%. and after 3 years, 27. Also, the reocclusion rate after 2 years of follow-up is 13% and 16% at 3 years. And finally, the stent thrombosis rate in this DES study was 6% at 2 years and 7% at 3 years. So what we can see here, first, we have a significant decrease over time of the rate of restenosis, reocclusion, and stent thrombosis. In all cases, we have a significant decrease. Also, we can see that at 3 years, the rate of restenosis, freedom from reocclusion, and stent thrombosis are pretty impressive. Also, the author and of CAPSICUM look at the halo. But in fact, in the paper, they spoke about aneurysm degeneration. So what is aneurysm degeneration? It's the halo image, what we can see around the stent, the DS stent, after implantation during the follow-up. In fact, and Dr. Ida in Linc states that, in fact, it was not aneurysm degeneration, but it was mostly halo. But what is very important here also is to see that halo is not related to worse clinical outcome. In fact, it doesn't seem to have any correlation, any relationship between the occurrence of halo and the occurrence of reintervention, stenosis, or thrombosis in this study. Also, what the Japanese colleague did, and I think they did an amazing job, they used the popcorn and the CAPSICUM study to compare, in fact, drug-eluting balloon, high dose and low dose, but also to compare DCB versus DES. And so what are the main information from this comparison between DS and DES? You can see here it's a 1-year rate of Eluvia versus DCB in unmatched and matched cohort. So in the unmatched, we have 35 patients in the DS cohort versus in the DCB cohort more than 1,500 patients. And in the matched cohort, we have still 728 patients in the DS cohort versus 728 patients in the matched cohort in the DS cohort. And so all these results seem significant, and it's important to see that in both analyses, we have a significant decrease of the restenosis rate in favor of DES versus DCB. They look also at some factors that could influence these outcomes, and it seems that only, in fact, the history of intervention, of endovascular intervention, seems to influence the occurrence of restenosis risk after 1 year of follow-up. So, in fact, what these releases, in fact, are pretty important, I think, because it's real life, and we didn't treat in a routine 7 or 5 centimeter lesion, but we treat a longer lesion, and here we have very strong results about the real life treatment of this femoropopliteal lesion. And so according to Popcorn, so the DCB study, with this 2 years follow-up, we have a favorable primary patency after DCB for femoropopliteal lesion in the real-world setting. Secondly, according to CAPSICUM, after 3 years, so midterm follow-up, we have acceptable restenosis rate for Eluvia DES, decreasing late event rate and no clinical impact of halo. Finally, when you compare CAPSICUM and Popcorn, so it's a Capricorn analysis and it's a propensity match cohort, we have it seems to have a lower and significant rate of 1 year restenosis in favor of Eluvia versus impact DCB. So I think you can find this information on the PVI website. And you should know also that more information are coming in the following weeks and months about new study and new release. Again, thank you for your attention and see you later.